Hello, I'm Michael Walsh, and I did my project using urgent healthcare clients to impact adolescents' obesity. Patient navigation. Patient navigators help guide a patient through the healthcare system or problem. This includes help get going through the screening, diagnosis, treatment, and follow-up on medical treatment. Education on the diagnosis and impact of disease. Help patients communicate with their healthcare providers to better make decisions about their health. Work as a team, a system, alongside others including physicians, nurses, insurance companies, health facilities, employers, case managers, lawyers, and others who may have an effect on a patient's healthcare needs. I'm Michael Walsh and I'm a patient navigator. I want to make an impact problem adolescent obesity. It is a major problem affecting everyone in the world. I think I can do this by capturing a group of people that may not get regular health care. Usually while one visits an urgent care center for a particular acute problem. I will capture a group that ordinarily does not get diagnosis and treatment planned for obesity early. The main cause of obesity is defined as the body mass index, or BMI, equal or greater to 95 percentile for age and gender. Although genetics and some disorders cause obesity, most adolescent obesity results from a lack of physical activity and consumption more calories than needed for their activity level. Obesity is a result of genetic, behavioral, environmental, physiological, social, and cultural factors that result in energy imbalance and promote excessive fat deposition. Some of the most common health behaviors that lead to obesity are poor nutritional health, lack of sleep, lack of exercise, and genetic disposition. There are many diseases linked to obesity, such as type 2 diabetes, high blood pressure, heart disease, certain types of cancers, sleep apnea, fatty liver disease, kidney disease, and pregnancy problems such as high blood pressure or high blood sugar. Next, I'll be talking about FIDO, the first part being frequency. New national data shows that 15.8% of young people aged 10 to 17, roughly 1 in 6, have obesity. This data comes from a 2016 to 2017 study. National Survey of Children's Health and are based on parent or caregiver's reports of a child's height to weight. Next, I'll be talking about intensity. Obesity is defined as a BMI at or above 95 percentile for the age and growth chart. The incidence of obesity is based on a person's BMI. As the intensity of obesity increases, so do the health risks. BMI is a simple calculation that can be calculated using a person's height to width. The calculations is BMI is equal to kilograms divided by mass squared. A BMI of 25 to 29.9 is considered overweight. A BMI of 30 to 34.9 is considered type 1 obesity. A BMI from 35 to 39.9 is considered type 2 obesity. And a BMI greater than 40 is considered type 3 obesity. Now I'll be talking about duration. The longer one is known as being obese often correlates with negative health outcomes. The average range of obesity duration is 2.5 to 26.5 years. The higher the stage of obesity, the longer it can take to decrease to a normal weight. The longer one has obesity, the more likely the comorbid conditions can occur. Next, I'll be talking about onset. Early detection, treatment of obesity can change the trajectory of morbidity and mortality. Racial and ethnic disparities exist among the chronic condition naturally. Non-Hispanic blacks have the highest rate of obesity, being 48.5%, compared to Hispanics, 42.7%, non-Hispanic whites, 37.1%, and non-Hispanic Asians, 12.7%. Next, I'll be talking about my proposal. Identification of adolescents at risk who have visited urgent care centers. This will include 11 to 19 years olds with elevated BMI who come to the urgent care center. Then we shall inform the parents that the child could benefit from the new program. This will include using smartphones via an app. Once they enroll in the app, it will have no extra costs. The app will educate on nutritional, exercise, sleep habits, and morbidities. This app will also track the progress and send the feedback via informatics and track and trend progress. This should encourage further weigh-ins from the urgent care center, usually once every 3 months for an entire year. Healthcare provider and system representatives. A select group of urgent care centers who agreed to participate are identified. A sample size of 50 patients are selected. If the research is found to be beneficial, potentially continue program for all. Funding should be from the federal via a grant for obesity. Informatics collected and reviewed for further research. Future review of sample group 5 years later to see if there's any morbidities that occur from obesity. This should make sure the research is successful. The impact of this, by identifying those at risk early and enrolling them into the targeted plan, I can potentially impact a significant targeted have knowledge and tools in the fight against obesity early on can change the trajectory of someone's health. Next, I'll be debriefing about what I think I did right and what I think I can improve on. I believe I represented myself professionally as a patient navigator. I feel I made the case that change is needed and possible in the fight against obesities. The one thing I feel like I can focus more on is more statistics, since I already used a couple statistics from SICE. I explained what obesity is and how it impacts one's health in future. I discussed the phyto/impact. I think my solution is practical and could be adapted by urgent care centers. The idea is novel in that you will work on a chronic problem in an acute setting, because when you visit urgent care, you only visit for small problems such as cold, such things that will go away in a couple of days. What I believe is important is to find problems that you don't focus on. I think my idea and setting was unique. What I could do better is discuss the apps in greater detail, such as who will be developing the app, how I get permission to use the app. I also wish to define how I could get the grant, such as more information and how I can get funding behind the app. This was my report. Thank you for watching.